What exactly is ADHD?
Those letters stand for Attention Deficit Hyperactivity Disorder.
What causes ADHD?
So the ADHD, this disorder, is a problem in the frontal lobe. What I mean by that is the brain is comprised of what we call lobes or sections. Frontal means front. This part of the brain is called frontal. This is the parietal, temporal, and occipital. The frontal lobe right here helps the person organize, plan, pay attention, make decisions, and control impulses. So ADHD there's a problem in the neurological, or what we call neural network, in this person's brain that's different from other children. And the chemicals, what we call neurotransmitters, such as dopamine or norepinephrine, they play a role in causing some of the struggles of what the frontal lobe is supposed to do adequately. In children, it's constantly developing. The frontal cortex within this frontal lobe is constantly developing even up to age 25. But in children who are struggling with ADHD, it's developing slower. So it looks like they're more immature or they're more hyperactive. Whereas many times it could be that they are struggling from ADHD.
Why is there a rise in this illness?
Well, first I want to mention what the prevalence rate is, meaning at any point in time, how many children are suspected to be struggling with a true diagnosis of ADHD. And the current number in the United States nationwide is around 9.4%. That's almost 1 out of 10 children are suspected to be struggling with this. In school-age children, the number starts to drop when you become an adult. And I think that this prevalence has always been the same, even in the previous generations. So the reason for the diagnosing rate being increased, number one, is because there's more recognition that there is an attentional problem caused by a disorder and not a behavioral problem of the child being lazy or wanting to act that way. So there's a recognition that there is a disorder, a brain disorder called ADHD. But socially, I think there's another issue going on in the current generation, is the fact that there is much decreased training in delayed gratification. What that means is children are less and less able to wait for that game or waiting in line to go into that room or getting their dessert. Delayed gratification is something that can be trained. And so many children start to look like they might have ADHD because they're so impatient, and caregivers and teachers have great difficulty in training children. Social media and the fact that there is this quick instant result by a click of a button on cell phones and iPads or tablets, computers, fast food, you name it. Everything is so fast. There's no need to wait. So that might be also contribute to what looks like an ADHD growing culture right now.
Do you think that access to media would be an important aspect to why ADHD can be more prevalent?
I don't think the existence of so many devices and the availability of that is causing more ADHD, I would think that it really contributes to ADHD being a struggle to be treated. Not that it would cause an increased prevalence. It's a brain disorder. And so you'll either have it or you don't have it. And how it appears in life and behaviorally can be manifested differently in a culture like the US, where the access to devices are so prevalent. The television, for example, it is such a gratifying experience for children with ADHD to stare at a screen that's constantly moving and constantly changing in scenes. Whereas in a less developed nation where access to television or devices aren't there, then other things would have to grab their attention. So it may look different in different cultures.
Do you think it's hereditary?
Yes, there is a hereditary part. It doesn't explain all of it. Genetics doesn't explain the entire picture of why somebody, because not everyone who had ADHD passes that gene down. Not everyone who has ADHD had a parent, but we do see it very often in families.
What are typical symptoms of ADHD?
Just like other disorders, when we diagnose them, there is a list of criteria that we need to see if the patient meets them. In ADHD, there are two separate lists of criteria. One is the inattentive list, and the other one is hyperactivity impulsivity set of criteria. For example, the inattentive list, there are quite a few in that list. To name a few would be inability to sustain focus, meaning for that age group, unable to remain focused for a long time, as expected. So for example, you would not expect a 5-year-old to remain focused as long as what you would expect from a 14-year-old. But compared to their age, the focus can't be sustained. They're very, very distractible. They avoid tasks that would require sustained mental effort. So it looks like they're very procrastinating, and it looks like they're lazy, but that's the symptom that they're going through. Losing items very easily and often, being oftentimes forgetful, or their name is being called, but they can't hear it. So they look like they're ignoring their parents. That is actually on the list for inattentive type. For the other list, hyperactive impulsivity, for example, being very fidgety and unable to sit still, or the urge to move around. So while they're really trying to sit still, they feel like their butt is wiggling and they have to walk around and move around. Sometimes it's shown by their legs constantly shaking, right? Sometimes they're fidgeting with their pens all the time. They can't keep their hands to themselves. While they're walking in stores, they're just touching everything in the store. Or they're blurting out and interrupting other people. So there are quite a few symptoms on that list. And if they meet the criteria, which is 6 out of 9, then we start to suspect that they might have ADHD.
Is there a ADD separate from the hyperactivity?
Yes, that's a very good question. Long time ago, the diagnosis was called ADD or ADHD, meaning either you only have the inattentive type or you have a combined type, both inattention and hyperactive impulsive issues. But these days, we only use one term. We say ADHD, and then we designate what type. Predominantly inattentive type, or predominantly hyperactive impulsive type, which is rare. Usually you will always have inattentive type. So it comes down to inattentive type or combined type. Those are the two we narrow it down to.
Is it common that young children have a lot of these symptoms and then they just taper off when they get a little older?
Very good question. The statistics of a childhood ADHD that will go on to adulthood ADHD is 50%, which means not every child or teen that struggled and received treatment would need it in adulthood. But that also means half of them will. So we don't know until they reach adulthood. And a lot of times that could be determined by executive functioning skills, structure, routine, and learning those skills at that younger age. So I hope I answered that question, that sometimes medicine or treatment can't be tapered off and sometimes they could.
How is this illness diagnosed?
Well, truly, I am a mental health professional, and the most appropriate way is an evaluation or an assessment by a mental health professional. And what I mean by that is a psychiatrist or a psychologist, but even primary care physicians can diagnose this as well because we all receive that training. I don't think it's fair enough to the child to read on the internet and diagnose it yourself, or ask a trusted friend. It really should be by a professional, such as many other medical disorders. We use scales, for example, the Conners or the Vanderbilt scales, because these are kind of like a Q&A questionnaire or rating scales that we give to both the parents, caregivers, and to a different environment, such as teachers. Because in order to get diagnosed, the symptoms of ADHD have to be predominant for at least about 6 months, in both environments. The other criteria is that at least by starting from age 12 or even younger, that these symptoms were prevalent. Sometimes we receive requests for evaluations from a college student. They're already 18, 19, 20 years old. And they said, "Doctor, I think I have ADHD. Please give me some medications." But they never, ever had any of these symptoms until a week before they saw us. Then sometimes we have to really question that. And that can be diagnosed by using an objective computerized test, which is great because long ago they did not have computerized tests such as the TOVA. TOVA stands for Test of Variable Attention. This is one of few that are out there, and a psychologist who's been trained in providing this examination would conduct that test, and there would be objective results because you can't cheat on this test.
If the child is diagnosed with ADHD and has been recommended to take meds, what about the fear of being addicted to it or changing their personalities or, just there's a lot of fear and misunderstanding. So could you address that?
Yes. Regarding the addiction fear, what's very interesting, and I hope all parents who have this fear can learn this, untreated ADHD has an even higher risk of the student growing up and becoming addicted to drugs. And that is a statistic proven. And this is because the impulsivity issue can become a problem where they don't have the judgment to avoid pleasure seeking. So if they don't have time to think about the consequences, which happens in ADHD sometimes, oh, why not some marijuana? Oh, why not some cocaine and amphetamine? So treating with medications helps that overall picture. The medication itself is not addictive if taken like the way the doctor or prescriber gives it. That daily small dose of a stimulant medication is just enough to help treat the scattered thinking and the hyperactivity and the impulsivity. So I hope that answers the question that the risk of addiction is a stigma and sometimes prevents children to receive treatment earlier. The reason why it is important, even if the diagnosis was made at age 6, to think about medication treatment, especially for moderate to severe anxiety, ADHD, is that the frontal cortex is developing, and it's developing at a slower rate than other children. So the executive functioning skills and training, the slower we keep it, they will gain those skills much later. Whereas treatment can help the normal rate of development and skills for retention, short-term memory, long-term memory, and so forth. Now, I think the other question was about changing personality. And for example, one that's very common is, oh, what if it makes my child become a zombie, right? Now, those are side effects, and if side effects are occurring, then the prescriber should stop and change the medication. Personality is an interesting fear. I did have parents tell me they were so outgoing and funny and very, very lively, but then the medication makes them look like they're sad. Well, what happened was it made them so calm. So they're just kind of quiet, but they weren't sad. The parents got so used to that when the medicine calmed them down a little bit, the parents became very frightened. Because like, what happened to him? Why is he not jumping up and down and running around the house? So we do have to have a balance. There is a side effect sometimes, very rare, to make someone sad, an actual depression side effect, which is rare. And when we pick up on it, we immediately discontinue and change the medication.
What steps can help prevent or alleviate ADHD symptoms?
If one truly has the condition of ADHD, it can't be prevented per se. For example, you can't wish it away and hope that it just goes away. And ADHD comes in various forms of severity. What I mean by that is you can have a mild form of ADHD to the point where nobody really have noticed, but they did have it. Mild to moderate, meaning it's mild on certain days and moderate when your attention is really being pushed. For example, taking an examination or presenting a lecture. Moderate to severe is when it starts to really affect your overall attentional ability. Every lecture, or even driving, or even having a conversation. There's attentional struggles in almost everything. This is mild to moderate. Moderate to severe. In children and students, if their grades are constantly suffering, no matter how much they're studying, and their IQ shows that they have the aptitude to understand the material, but they just can't get those questions correct, then they might be suffering from moderate to severe and therefore might need treatment. So one can prevent worsening, I'll start off with that, by, for example, avoiding drugs and alcohol, right? Sometimes these kind of illicit substances and alcohol worsens the concentration. You can imagine how it could do that. Poor sleep, poor nutrition, poor health definitely has a role because of that biopsychosocial model that we've been talking about. Another prevention is don't consume so much sugar, because there is a high and then there's a crash, right, that sugar can cause. In order to alleviate or treat ADHD, medication treatment is the number one choice because it's a neurotransmitter, neurological problem in the brain. But many times families cannot obtain it, and many times they don't want it. They don't want to start off with that. So we would recommend executive functioning skills training. Executive functioning skills training means helping the child or the student learn ways that can help them with planning and organization, time management, thinking ahead, how to meet deadlines, and how to control their emotional impulses. So executive functioning training can be provided by a professional. And to be honest, many parents know this already naturally, but their children, they don't want to listen to mom and dad. So we have to sometimes use professional help in teaching them. I've had many students who did not even know how to use their calendar, right? Whether it's a paper calendar planner or even on their phone. How to put alarms, how to read time in their body, because they can't read time, not the fact that they can't read a clock, meaning they can't feel time is passing. So they have to use alarms, they have to use reminders, they have to use visual cues. These are examples of executive functioning training. Some kids feel that I have a lot of time, so they'll study last minute for an exam. So helping them pace their time little by little up until the night before an exam, because otherwise they can't retain that information. Another important item is for parents and teachers to try to avoid shaming the child whenever they're struggling with symptoms of ADHD, and avoiding placing unrealistic expectations. Unfortunately, I'm Asian, right? So I'm Korean American, and I come from an Asian family, and Asian students around me with their Asian parents have a lot of expectations. And with ADHD, sometimes they won't get that straight A, especially if they're not treated. So if we're placing unrealistic expectations for someone who does not have that neurological capability, that can bring on anxiety. Another item is to provide tools, and parents and teachers can really help with creating structure, to create a routine and decrease distractions. So if you as a parent or teacher or caregiver are not organized, you're always late, and meal times are all over the place, and sleeping time is all over the place, then someone who has ADHD growing up, they're already distracted, they're already disorganized, and they don't have any example of routine and structure. That will make it very hard for them. And lastly, is going back to the identity, especially spiritual identity, is reminding the child or the teen that ADHD, depression, anxiety, any other illnesses that they may be going through does not define them. Your true identity is a child of God who happens to have a struggle with attention, who happens to have more worries than other kids, who happens to have deeper sadness than others at times. But that does not change who is living inside of me, who loves me so much, unconditionally. So we have to keep reminding them, irregardless of your grades, irregardless of your report card result, you are a beloved child of God, and you are a beloved child of mine. This is a very important message that parents should have.